Hello, Emma. Can you explain the veins of the heart to me?
Of course. The veins of the heart, known as veni cordis, drain blood from the myocardium. They are quite similar to the coronary arteries in terms of their course, and they follow a similar path. However, heart veins don't have valves along their path.
How are these veins classified?
The heart veins are classified into three main groups based on where they drain. 1. Veins draining into the coronary sinus. These carry about 60% of the heart's blood. 2. Anterior veins of the right ventricle. Veni ventriculi dextri anteriors. These carry about 34% of the blood. 3. Small cardiac veins. Veni cordis minime. These carry about 6% of the blood.
What can you tell me about the coronary sinus?
The coronary sinus is a wide venous channel and the main collection vessel for blood returning from the myocardium. It is located in the left coronary sulcus and drains into the right atrium. At its opening, there is a valve called the valvula sinus coronarii. The coronary sinus collects blood from several major veins. 1. Great cardiac vein, vena cordis magna. It begins as the anterior interventricular vein at the apex of the heart, travels in the anterior interventricular sulcus, collects blood from the left ventricle, and continues as the great cardiac vein. It then runs to the back of the heart and drains into the coronary sinus. 2. Middle cardiac vein, vena cordis media. It starts at the apex of the heart, travels in the posterior interventricular sulcus, and drains into the coronary sinus before it opens into the right atrium. 3. Small cardiac vein, vena cordis parva. It starts along the inferior margin of the right ventricle as the marginal vein, runs in the right coronary sulcus between the right atrium and ventricle, and drains into the coronary sinus.
What about the veins of the right ventricle and the smallest cardiac veins?
The anterior veins of the right ventricle, veni ventriculi dextri anteriors, are 2 to 4 veins on the front side of the right ventricle. They run from the apex towards the coronary sulcus and drain directly into the right atrium independently. They do not follow a common path with other veins and can sometimes drain into the small cardiac vein. The small cardiac veins, veni cordis minime or Thebesian veins, are tiny veins that drain directly into the nearest heart chambers. They are more numerous in the atria but can also be found in the ventricles, especially at the apical part of the septum. These veins account for up to 40% of the blood returning from the coronary circulation, along with the anterior veins of the right ventricle.
Why is the coronary sinus important?
The coronary sinus is crucial because it sometimes serves as an additional entry point for the left superior vena cava if the right superior vena cava is absent. This anatomical variation allows blood to enter the heart. Additionally, the coronary sinus is used in medical procedures such as the insertion of pacemaker electrodes, which can be threaded through the coronary sinus to reach the left ventricle and the outflow tract.
Can you summarize the main heart veins and their locations?
Certainly. Here's a quick summary. 1. Anterior interventricular vein, V. Interventricularis anterior, runs in the anterior interventricular sulcus. 2. Great cardiac vein, V. Cordis magna, runs in the anterior interventricular sulcus and then in the left coronary sulcus. 3. Coronary sinus, located in the left coronary sulcus, draining into the right atrium. 4. Middle cardiac vein, V. Cordis media, runs in the posterior interventricular sulcus. 5. Small cardiac vein, V. Cordis parva, runs in the right coronary sulcus. 6. Anterior veins of the right ventricle versus anterior ventriculi dextri drain directly into the right atrium. 7. Smallest cardiac veins versus minime or Thebesian veins drain directly into the nearest heart chamber. These veins all play vital roles in draining deoxygenated blood from the myocardium back into the heart for reoxygenation.